Christina Liang is a neurologist at the Royal North Shore Hospital here in Sydney and also the Neuroclinic at the Prince of Wales Hospital. She works with people affected by a range of neurological conditions, but has a special spot in her heart for mitochondrial disease. The topic today is a tricky one. Many people living with Mito are told about dietary supplements, but there are so many options and mixed advice, it can be incredibly difficult to find out what will help. Dr. Liang has worked with Mito Foundation on our Dietary Supplements Advisory Group, which recently published new resources on our website about dietary supplements to try and help people affected by Mito navigate this difficult topic. In this session, Dr. Liang will talk about what we already know about supplements, what we still don't know about supplements, and what new research is starting to tell us. And she'll also give you some practical advice of what to do to talk to your healthcare team and figure out what's right for you. I encourage you as a part of this session to consider any questions you have. It's another tricky one because we won't be able to go into detailed advice about your individual situation, but Christina has promised me she'll do her best to answer the questions that you give us. So please consider those and submit them, whether you're online. This will be your first session to practice submitting a question, and Laura will be asking those in the room. Or if you're here in the room, encourage you to store that away and we'll come to you with a roving mic at the end. So please join me in welcoming Dr. Christina Liang.
Thanks very much, Claire, and thank you for having me today. So if you were expecting the standards of care, that will come at the end of the session, but right now we're going to start with supplements. I'm a neurologist, but I mainly look after adult patients. So if there are questions that you ask later on that I cannot answer, I invite anyone here who can answer them to put their hands up and we can learn together. So over here, I might just ask, who of us are actually on some sort of supplements? Who here are on more than 3 supplements? Ooh. More than 5 supplements. Okay, there are some of you who are on more than 5 supplements. So supplements and mitochondrial disease, yes or no? So today we will go through a few of these things, including which supplements are actually commonly used, which supplements are actually evidence-backed, and they seem to be more specific to specific diseases. Supplements we will talk about, which has limited evidence in mitochondrial disease, talk a little bit about their mechanism and potential benefits, how to access quality products, and finally, how to know if a supplement might or might not be helping. Now, of those people who are actually on supplements, whether you have mitochondrial disease or not, who actually think that their supplements is definitely working? Okay. Who here are not sure that the supplements are working but are still taking them? And finally, who are the ones, actually, that covers it. We will move on. So this is revision for you. So in 2016, a paper has been published in the US talking about patients over in the US and their use of supplements. You can see that the majority of them were taking supplements. And in fact, 3/4 of them were taking more than 4 supplements, which they pay a lot for, more than $500 per month, US dollars. And this is before the inflation. And this is despite them being on medication and physical therapy. Nearly half the patients think that the supplements are the only intervention that they're having that's helping them. The symptoms they're trying to treat include being weak, feeling fatigued, having exercise intolerance, having muscle aches and pains, irritable bowel, droopy eyelids, headache, migraines, and anxiety. The most commonly used supplement was actually coenzyme Q10, followed by L-carnitine, riboflavin, which we will go into, vitamin D, and vitamin C. About half of the patients reported that 5 of their most bothersome symptoms were actually alleviated, including that of fatigue. But the less responsive symptoms included the gastrointestinal symptoms and the neurological symptoms such as headaches, seizures, and the jumpy myoclonus and stiffness. About 1/3 of the patients thought that there was no benefit, but nonetheless, they were still taking them. Now, this is versus a Dutch study, also an older study, about 10 years old. And while the patients still paid a lot of euros for their supplements, the Dutch actually thought that their non-pharmacological efforts, such as self-help techniques with massage, exercise therapy, and yoga, works better than the supplements. Most recently, we now have the doctor's view. This was a survey that was conducted from the European Centre, which involved 35 countries. The majority of clinicians in this particular set of people doing the study was pediatrician. And you can see that about 95% of pediatricians were actually recommending supplement use. And you can see that this actually contrasts with the evidence that we have or don't have for supplements. Now, you may be able to see that these are some of the more common supplements. L-carnitine, so the ones that are in green coming down, and the orange one are the ones that are used most commonly. The next one is riboflavin or vitamin B2, and you can see thiamine, vitamin B1, as well as ubiquinone and ubiquinol, which are coenzyme Q10. So now, which supplements are actually evidence-based? If there was clear evidence for mitochondrial disease, every doctor you would think would be prescribing the same thing. And I bet you each of your doctors might be suggesting a different thing, or you might actually think a different supplements might be working for you or your child. The things that we have good evidence for include things like fluoride in toothpaste. Everyone brushed their teeth today, right? Yes. Things like aspirin for clot type of stroke or heart attacks, and bisphosphonate for people who have osteoporosis. But there are actually only a very few mitochondrial diseases with clear evidence for specific supplements. And the issue is, for mitochondrial disease, the number of patients with each condition is very small. And we can go through some of these conditions, how the evidence comes about. It's nothing like the stroke, where we know a lot of our relatives might have, our elderly relatives might have, or we see through emergency, where there are tens of thousands of patients who have experienced the episode and tried aspirin, and we can say aspirin give you this percentage of benefit of reducing stroke. So these are actually the main conditions, and these are actually not the most common mitochondrial conditions that we see each day. And you can see the things that has been tried include coenzyme Q10, then there's biotin, which is B7, thiamine B1, biotin again, and riboflavin. And we could be forgiven for some of our children may have been put onto the medication or the supplement thinking that this person might have a particular genetic condition that this can treat. And sometimes as adults, we see those patients who have been put onto, say, thiamine or very high dose of biotin, who are subsequently found to have a condition that actually does not necessarily respond to biotin, but they remain on that medication for a long time. Now, who remembers their science days and studying the cellular respiratory respiration? I have to admit, I've forgotten some of it, but if you remember, you know it better than me, put up with me. So here we all use food and oxygen. Yep, that we all agree. And they are transported into the cells. And energy production involves both the cytosol, which is the fluid that is inside the cell but outside the mitochondrion, and also involves the mitochondrion, which are the batteries of the cells. And we can have hundreds to thousands of copies of the mitochondria in each cell. So the energy production process starts with glycolysis. And this is just a name for the process where glucose or sugar is broken down to pyruvate. The pyruvic acid then goes into what's called the Krebs cycle by producing citrate. And then in each of these processes, energy in the form of ATP is actually produced. And after the citric acid cycle, there is NADH that is then transported into the electron transport chain. And if you study or read about mitochondrial disease, this is the one that we usually talk about. And we will have some diagram later on about that. Now, firstly, I want to talk about vitamin B1. Vitamin B1 is thiamine, and how it is used is actually in this process. Up here in the glycolysis. It's a cofactor that helps with this particular process in the cytosol. And it helps with energy production. People with thiamine metabolic disorders often present with confusion, basal ganglia disease. Basal ganglia are this part of the brain, the middle of the brain, in the deep gray matter, and also lactic acidosis. But the treatment of thiamine are very specific for certain genetic subtypes, and one of them include this thing called SLC19A3, which stands for biotin thiamine responsive basal ganglia disease. And this is one of the MRIs of a patient who has this condition. So if you treat them with biotin combined with thiamine, the patients actually do respond. Now we come to the respiratory chain, which is the electron chain that we saw in the bottom right corner in the picture before. So you can see what you may be more familiar with, complex 1 going to with the coenzyme Q10, complex 2, complex 3, 4, 5, and then finally with the electron gradient, you've got ATP production and as well as the reactive oxygen species, which can be toxic to cells. And I'll put it through so that you keep in mind this NAD/NADH, which has relevance to nicotinamide use, and FAD or FADH, which has to go with the flavin complex that goes with riboflavin, which is the next thing we're going to talk about. Riboflavin is vitamin B2. People without mitochondrial disease might be using it for headaches sometimes. Here you can see that it's a precursor for the electron carrier, FAD, which we saw in the picture before. It's a cofactor for the respiratory chain complex 1 as well as complex 2. But its use in terms of some evidence that it helps is actually in this condition called ACAT-D, ACAT9 deficiency. With this particular family of the protein, people can present with cardiomyopathy, muscle diseases, exercise intolerance, and again, lactic acidosis. Now, the study has not been in many patients, nothing like, the normal stroke. It's only in about these 22 treated patients and 17 untreated patients. But what this particular study in 2018 was able to show is that in patients' fibroblasts, the complex 1, for those who were on therapy, the yellow ones, except in 2 of the patients, all improved their complex 1 activity. And you can see the survival curve of infants or children. Those who have been given riboflavin survive much longer, whereas those who were not on it, they actually passed away at a much younger age. So even though the number of patients tested in this particular condition were not that many, you can see quite clearly that 65% actually showed a positive response to the therapy. Sometimes we'll have even less number of patients being treated with a particular supplements, biotin being one of them. Biotin-based deficiency is not the primary, but you can count it potentially as a secondary mitochondrial problem. And you can see in this particular condition, which can cause seizures, developmental delay, and also skin changes and hair loss, that this is an infant who has the condition. This is the before, where you can see the white matter in the brain on an MRI being whitened out. But with biotin high-dose supplement, you can see that it actually normalizes. So that can also be a clue that the medication or the supplement actually is working. But for most of us, whether we are people who don't have mitochondrial disease or people who have mitochondrial disease, we have to come back to basics. So this comes back to a little study of 60 patients who did a 3-day nutritional diary. And these were patients who have the more common forms of mitochondrial disease, including maternally inherited diabetes and deafness, CPO, and mitochondrial myopathy. Most of them were on more than one supplement. What they found that despite their supplement use, these patients most commonly are actually lacking vitamin D, calcium, and in fact, fluid intake. Most of them don't drink enough through the day. And I wonder how many of us actually have the same problem. Now, there hasn't been a kind of laboratory study in human, but for mice, vitamin D has actually been associated with reduced activity of complex 1 and complex 2 in the mitochondrial respiratory chain. So you can see that these mice were deficient in vitamin D because they weren't in the sun and they weren't fed any vitamin D. And after 3 months of deficiency, you can see the graph showing reduction in those complex activities. And they also found that their lean body mass actually reduced. Now, does this apply to human? And this particular study actually shows older people, these are people who do not have mitochondrial disease, who have a vitamin D deficiency. If you supplement them with high-dose vitamin D for a 6-month period, you can see that there's a trend of improvement, particularly for the over 60-year-olds who are vitamin D deficient, to improve in terms of their lean body mass. So we don't have a clear study in mitochondrial patients, but perhaps particularly if you haven't had your vitamin D checked and you're not in the sun enough, you should consider getting it checked because it's easy to replace. The recommended daily dose of vitamin D is about 600 international units or 15 micrograms for ages 1 to 70. For people older than 71, it's a little bit of a higher dose. It's not an expensive supplement, and we aim for most people's blood results to come to about 70. And most of the supplements you can get from supermarket, it's about 1,000 international units, which is equivalent to 25 micrograms. And sometimes you can actually have it included in your multivitamins. But check the back, because each different multivitamin would have a different dosage of vitamin D. Other things I'll quickly just to remind you is that these supplements are easy to get, they're cheap, but if you're deficient in them, you can get into grave trouble. So those include the vitamin B12, because deficiency can cause neurological deficits. Folate, again, it can also cause neurological deficits. And iron, in particularly for women who might have heavier periods or those with gastrointestinal loss or after surgical intervention. And you can see that if you're deficient in iron, your red blood cell over time can actually get smaller and more transparent. Whereas if you're deficient in vitamin B12 and folate, you can actually have your red cell blow up very big and irregular, and you have abnormal white blood cell. And all of these can be corrected if you supplement it correctly. Things to avoid, you might have heard from the news, is actually things like vitamin B6 or pyridoxine. It's also called pyridoxal sometimes, because often in your supplements, we only actually need about 1.5 milligrams a day. But in some of your supplements, you'll be surprised you have 50 milligrams of it in your supplement. If you take it once a week, no problem, it's good for you. But if you take it every day, you'll be overdosing yourself. Vitamin C, if you take the usual 1 tablet or 1 chewable tablet, it's okay. But if you take more than 3 grams, we have had one patient who came in with kidney problem because they developed kidney stone that blocked their kidney from working. And I also ask you to be careful of the fat-soluble vitamins, which usually don't tend to be deficient in most patients. So if you're supplementing yourself with this, make sure you don't overdose yourself. I'll put a note now for specific condition for people with MELAS, because MELAS in the adult world consists of about 1/3 of our patients. And L-arginine is a controversial, I say, supplement in terms of daily use. Whereas it's intravenous use, I think in Australia, for acute episodes, we still use it for most centers. L-arginine is a nitric oxide precursor or donor, and is thought to help with the dilatation of the vasculature, particularly in patients when they have a stroke-like episodes. So this was actually studied only in 24 patients originally in 2007 from a Japanese group, and who had 34 stroke-like episodes. So if you say compared to the normal strokes, this is minimal evidence. And I can tell you that UK clinicians, particularly from Newcastle upon Tyne, they will not be using this agent. Whereas the people in America, they will be using this agent. The dose is 0.3 gram, not milligram per kilogram per day for normal maintenance. So this is the American evidence to say that patients in acute presentation should be treated in 3 hours. And I'll quickly mention L-citrulline. L-citrulline is thought to work and be more bioavailable than L-arginine. But compared to L-arginine, it has even less number of patients having tried it and proved helpful. So there has been 5 children with MELAS and 5 people with control, and they compared it, and they found that the nitric oxide production rate was actually increased, definitely in the 5 children who were on citrulline as opposed to the 5 controls. So I will actually gloss through taurine because it's not very commonly used. But now we will come to supplements with limited evidence in mitochondrial disease, which nonetheless we often use. Remember the respiratory chain with the NAD down here and the FAD up here around complex 1, complex 2, and the coenzyme Q10, which is meant to act as passing the electron from complex 1 and 2 to complex 3. So you can see this slide, which includes multiple supplements. Coenzyme Q10, we've talked about, helps with the electron transfer. So does riboflavin. You can see thiamine down there, sorry. And then you can also see nicotinamide riboside, carnitine, things that bypasses the specific respiratory chain complexes of vitamin C, vitamin K3. You've got the antioxidants, and you've got the buffering agent with creatine that bodybuilders also use. Now, why do people use supplements? Because you don't need a script. You can get whatever you want. If you read, you think it's helpful, you could try it. It might be more affordable than some of the medication, particularly, for example, the idabenone, which has been studied in Leber's hereditary optic neuropathy. We used to be able to get it quite cheaply through iHerb for a substantial amount. Now it's very expensive. And in fact, most patients cannot access idabenone. But you need to know that the efficacy is inconsistent. We are not sure whether it works, and it hasn't been really studied or regulated well. And I ask that if you do try supplements, you make sure you check whether there's any interaction with what you're trying to the medication that you're already on. And also check the actual ingredients. This is coenzyme Q10, and it's thought to be helpful in about a quarter of patients with mitochondrial myopathies. Ubiquinone is the oxidized form, and ubiquinol is the reduced form. And if you were going to take coenzyme Q10, you need to remember that it is lipophilic. So if you take it with some fatty food, it tends to absorb a little bit better, which is what we call about the bioavailability. And in fact, if you take smaller amounts with each capsule and take more capsules, so say 30 milligram capsules, 10 of them, as opposed to one 300 milligram capsule, you mean to be able to absorb a little bit better as it goes through the guts for you. The study was only done in 30 people, 15 with MELAS, 11 with CPEO. And what they found is that it's actually mainly a minor effect in those doing the cycle exercise aerobic capacity at high level of exercising. A similar study was later done in another group, which also showed a similar result. But I just want to quickly talk about statin myopathy, because that's actually what we normally see in adults. A lot of patients are on statin after they might have had a stroke or have had a heart attack, and often the coenzyme Q10 level is actually reduced in them. And even for those patients who we have a lot more of them, like 300 of them and 500 of them, one study suggests that it doesn't work, whereas the other study suggests that it might work. So you need to keep in mind that evidence actually builds up over time. This is the other study that I was talking about, again showing coenzyme Q10 helping small number of patients perhaps, but you can see that the bioavailability of the drug is very variable. You can see that if you were taking the black drug, which is one type of coenzyme Q10, you get a significant increase in the level in your blood. Whereas if you were taking the gray one, it's like you were taking nothing down here. So you need to understand that it doesn't have the stringency of medication that's normally given. But I'll ask you to keep an eye out for studies, potentially in the next few years, on coenzyme Q10 precursors. And these are these things. They form in the body and helps produce coenzyme Q10. So they studied it in a HDPDL1 mice knockout, and these mice present with stiff legs and seizures, and they found that they could live for longer. And whereas for the 4-HB, it's actually been studied in boys, an 8-year-old boy and a 3-year-old boy. And what you can see in this particular study, even though it's only one person, you can see significant improvement over time from not being able to walk or to being able to run, from falling every day to rarely falling over. So sometimes, even if the people that they tried on is very small numbers, if it shows a clear evidence, it can be helpful. So now we come back to the respiratory chain, and we'll quickly mention about vitamin B3, and I'll put a caveat on it. In the past, maybe 5 to 10 years ago, we thought that this drug works through the sirtuin pathway. And this is the precursors to the NAD that we saw on the diagram. But now newer studies have shown that it actually doesn't work through the sirtuin pathway. Sirtuin 1 is not actually responsible for mitochondrial biogenesis. So the opinion pieces from athletes is that taking this drug in its various form actually does not help people who are normal, does not have mitochondrial disease, and does not have an NAD deficiency. These were the older study. Again, you can see small numbers based on 5 patients that show that niacin, a form of vitamin B3, was helpful in a number of these, helping with body fat, etc., liver fat, helping with increasing fasting glucose and muscle strength. But again, it was based on 5 patients. The nicotinamide riboside was considered because it has better absorption and less side effects. And so I don't know that we can really recommend clearly with nicotinamide riboside, but what we can say is that this has not been studied in larger number of patients with NAD deficiency who has mitochondrial condition. So if you want to try, you just need to make sure that you go in with eyes open. L-carnitine has been studied in 12 patients as opposed to 10 control, and supposedly improved aerobic capacity and exercise tolerance. And creatine has been studied in 7 patients with mitochondrial disease and shown to have increased high intensity anaerobic and aerobic type of activities. And those are not, what we do normally going upstairs, etc. If you were more interested, you can take a photo of this. This is from the NIH, and you can look at each of the individual supplements, whether it works or doesn't work. What the evidence and what the doses to take, so that, because we won't be able to mention all of them today. Now, finally, how do we access quality products? So here we ask you to have a look at AUST R and AUST L. AUST R are medication that are registered, even if you don't need a script for it, including Panadol or paracetamol, which proves that it actually helps with pain relief. So it is registered, it shows effectiveness. AUST L is when it's a listed medication. So what it says it has is what it has in the medication or the supplements, but it hasn't been shown to be effective. So you can see usually in small prints, the AUST L, and in paracetamol, the AUST R, because it's proven efficacy. And again, for your supplements, particularly the magnesium supplements and the vitamin B complexes, just to check how much of each of the ingredients it has. You can see pyridoxine hydrochloride has 50 milligrams. So if you have 50, take it once a week, not every day. So finally, how do we know whether a supplement might or might not be working? And we may or may not be clearer, but you can try these things. This particular form is on the Mito Foundation. So what we're really looking at for the particular person with mitochondrial condition is an N=1 trial. That is when this condition is so rare and whatever you're trying hasn't been tried in a large cohort, you can try. And you try to pick the particular bothersome symptom, whether it's headaches, fatigue, or exercise intolerance, whether it's a bowel problem or cognitive clarity, and you try to document it. So for those of you who would like to monitor multiple symptoms, you can put it into a diary. And for example, for this diary, headache is red, flights of stairs that you can do is blue, and bowel motion, whether you open or not, is in black, for example. And this is 4 weeks worth, Monday to Sunday worth of documentation. And we suggest that you find a baseline, because from day to day, the symptoms might be different depending on how well you have slept or how much you have done the day before. So once you've had an average that you can gauge over the 1 to 3 months when you try a new supplement, whether it's something that's helpful or not. These are some of the diaries, and you can feel free to take a picture that is online and free. This is a headache diary, and it helps you because it's got the whole year worth of headaches that you can look at in one glance. There are also activities diary. So this one over here is a weekly one. You can state exactly what you've done at what time and the duration, whereas this one on the right is stating over an hourly period for 1 week what you have done. So you can take your pick, what suits you, what you find easy to use. And finally, there's also the mood diary. This is from the Black Dog Institute, which monitors hourly to hourly how over a month period, how your mood has progressed. So this is the summary of what we've briefly talked through about what's commonly used, what actually has evidence-backed, what has limited evidence, how to access your AUST R or AUST L therapies, and also how you might be able to monitor how you're going on a particular supplement. So thank you.